Welcome back, everyone. Today we're taking a deep dive into some fascinating research on mindfulness and pain.
Yeah, it's pretty cool stuff.
It seems like mindfulness could be like totally rewiring how our brains respond to pain.
Right, and not just like masking it.
Yeah, exactly. Like actually changing things at a deeper level.
Exactly.
I'm really curious to see what our sources have to say about all this.
Yeah, should be interesting. We've got some studies that look at how mindfulness can change how we experience like both physical and emotional pain.
Okay.
And there's even research that suggests that mindfulness can change how our brains predict pain
Wow.
instead of just like dulling the sensation itself.
That's wild. Okay, so before we get into the actual research,
Sure.
can you give us a quick refresher on what mindfulness is
Absolutely.
and how it differs from, just like trying to ignore pain?
Yeah, for sure.
Because I think there's sometimes a misconception there
Right.
where people think it's just about like, pushing it away.
Yeah, mindfulness is really about being present in the moment, without judgment.
Okay.
It's not about like emptying your mind or anything like that.
Right.
It's more about observing your thoughts and feelings and sensations as they come up.
Mm-hmm.
And the key here is acknowledging them without getting carried away.
Okay.
So you're not resisting them or labeling them as good or bad. You're just kind of letting them be.
So it's very different from suppression then.
Exactly. Yeah, where
Yeah.
you're actively trying to push those unwanted thoughts and feelings away.
So with pain, then it's more about acknowledging that it's there rather than trying to pretend it doesn't exist.
Exactly. You would notice the pain where it is, how intense it is, and any other sensations that come with it,
Mm-hmm.
but you're not resisting it or labeling it as bad.
Okay.
And this acceptance, this non-judgmental observation seems to play a big role in how mindfulness might impact pain perception.
I see.
And this actually ties into a concept called interpretation bias, which basically means that we sometimes tend to interpret things negatively,
Mm-hmm.
especially when we've had tough experiences in the past.
So like, for example,
Yeah,
if you've had a lot of back pain in the past,
right.
little twinge in your back might make you think, oh no, here we go again.
Yeah,
Like I'm about to have another episode of severe pain,
exactly.
even though it's probably nothing serious.
Yeah, your brain is kind of jumping to conclusions based on those past experiences,
Right.
even if the current situation is totally different.
Okay, so that's where mindfulness comes
It's
in.
what some of the research suggests. Yeah,
It can help us break free from that bias.
potentially. Yeah.
Okay, so there was one study that I know we want to talk about
Mm-hmm.
by Venkatachelam and colleagues
Yes.
from 2021, I believe.
2021, that's right.
And they looked at how mindfulness practice affects something called pain cueing.
Yes, exactly.
Can you explain what that is?
Yeah, so think of Pavlov's dogs.
Okay.
They learned to associate the sound of a bell with food, right? So eventually they would start drooling just at the sound of the bell, even if there wasn't any food.
Yeah.
And our brains do something similar with pain.
Oh, interesting.
We learn to associate certain sights, sounds, or situations with pain.
So like if you always stub your toe on the same coffee table,
Uh-huh.
you might start to tense up every time you walk by it,
Exactly.
even if you're nowhere near stubbing your toe.
Yes, that's pain cueing in action.
Wow. So it's like our bodies are already preparing for that pain.
Right. And what's interesting is that Venkatachelam's study found that mindfulness practice actually reduced the impact of this pain cueing.
Oh, wow.
So participants who practice mindfulness weren't as affected by the expectation of pain.
So even if their brains had learned to link a certain cue with pain,
Yeah,
mindfulness helped them detach from that automatic response.
that's right. And here's where it gets really interesting.
Okay.
They found that mindfulness had an even bigger impact on reducing conditioned hypoalgesia.
Okay, I have to admit that one went over my head.
Yeah, no problem. I can
Yeah,
break that down. Can you explain what that means?
So hypoalgesia just means a decreased sensitivity to pain.
Okay.
And conditioned hypoalgesia is when we expect less pain.
Mm-hmm.
And our brains actually follow through on that expectation.
Yeah.
It's kind of like a placebo effect, but for pain.
So if you believe a treatment will work, you might actually feel less pain because of that belief.
Exactly. And what this particular study suggests is that mindfulness might be especially effective at helping us unlearn those overly positive expectations.
Interesting.
Those conditioned hypoalgesia responses.
So even if we've convinced ourselves something will work, mindfulness helps us see things more objectively.
That's what it seems like.
Yeah.
Yeah.
Wow.
No, we don't fully understand how this works in the brain yet.
Right.
But there is some brain imaging research that suggests mindfulness might be weakening the connection between the parts of the brain that predict pain And the parts that actually process the sensory experience of pain.
So our brains might still be anticipating pain.
But the feeling isn't as intense because of mindfulness.
That's one way to interpret it.
Yeah.
Yeah, it reinforces the idea that mindfulness helps us rely less on those learned pain predictions,
Oh, okay.
whether they're negative or positive.
So it's not just about, changing how we think about pain.
Right.
It might be about changing how our brains are actually wired to respond to it. This is blowing my mind.
It's pretty amazing stuff.
Okay, so there was another study, right?
Yeah.
That delves deeper into these learned pain predictions.
Yes, a 2021 study by Zeekenhuis and his colleagues.
Okay.
And they looked at how instructions could actually influence pain perception.
Instructions. Like someone telling you to expect the pain to be really bad or not so bad.
You got it, yeah. They had people go through a pain cueing task, but some were explicitly told about the likelihood of high or low pain after a specific cue,
Okay.
while others had to figure it out on their own.
So some knew what to expect, and others were in for a surprise.
Exactly, and their findings were fascinating.
Okay, I'm on the edge of my seat.
Just by giving instructions, they could significantly change how people perceive pain.
Wait, so if you told someone the pain would be worse, it actually felt worse?
Yep, and vice versa.
Oh my gosh.
Telling someone the pain would be less intense actually made it feel less intense.
Wow.
So it really shows the power of expectations in shaping our experience of pain.
That's incredible. So even if the actual pain signal is the same, our brains can interpret it very differently depending on what we think will happen.
Absolutely. And this is where the connection to mindfulness comes back into play.
Okay, how so?
If our expectations and past experiences have such a strong influence on how we perceive pain, mindfulness might be a way to unlearn or become less reliant on these learned pain predictions.
So by practicing mindfulness, we could potentially regain some control over how our brains interpret pain signals.
That's the idea.
This is amazing.
And this leads us to another study that looks at how past experiences with pain can shape our perceptions. This one by Gaffiero and colleagues and published in 2022 uses ambiguous scenarios.
Ambiguous scenarios. What are they?
They're basically situations that could be interpreted in more than one way.
Okay.
So Gaffiero's team created a set of scenarios that could be seen as either pain-related or totally unrelated to pain.
So something that could be a sign of pain but could also be something completely normal.
Right. For example, one scenario might be you see a red stain on your shirt.
Okay.
You might immediately worry that it's blood.
Right.
But it could just as easily be ketchup or wine.
Oh, that's a good one.
Sure.
Yeah, I can see how our minds could go straight to the worst case scenario in that situation.
And that's exactly what they found.
Okay.
People who had experienced pain more recently were more likely to interpret these ambiguous situations as signs of pain.
So if you've been dealing with pain lately, you're more likely to see potential pain everywhere you look.
It seems so our brains are wired to predict what's coming next. And when it comes to something like pain, which could potentially harm us, those predictions tend to err on the side of caution.
Makes sense. It's like our brains are constantly saying, better be safe than sorry.
Right.
But that can be a double-edged sword, right?
Yeah, for sure.
If we're always interpreting things as signs of pain, we might end up living in a state of constant fear and anxiety.
Exactly.
Which could actually make the pain worse and harder to manage.
That's exactly right.
So how do we break free from that cycle? Is mindfulness the key?
Mindfulness could be a valuable tool.
Yeah.
Yes, by practicing mindfulness, we train our brains to observe our thoughts and feelings without judgment.
Okay.
Which can help us become aware of those automatic pain predictions.
Yeah.
And give us the power to choose how we want to respond to them.
So we're not necessarily trying to stop our brains from predicting pain.
Right.
We're trying to change our relationship with those predictions.
Exactly. Mindfulness helps us create some space between the prediction and our reaction,
Okay.
allowing us to choose a more helpful response.
This is all so fascinating. It seems like mindfulness is working on multiple levels.
It really is.
From our thoughts and feelings to potentially even the way our brains process pain signals.
It's definitely a complex puzzle, but we're starting to put the pieces together.
Yeah.
And there's one more study we should look at.
Okay.
Which goes even deeper into how the brain is wired and how that relates to pain perception.
Yeah.
This one uses something called resting state fMRI and different brain parcellations.
Okay. I think I need a visual for this one.
Sure, yeah.
What exactly are they looking at in the brain?
Okay, so imagine you're looking at a map of a city.
Okay.
You could divide the city into different neighborhoods, or you could divide it based on function.
Okay.
Like the financial district, the shopping district, residential areas.
Right.
Brain parcellations are kind of like that.
Okay.
They're ways of dividing the brain into different regions based on their anatomical structure or their function.
So they're looking at how different parts of the brain are connected and communicate with each other,
Exactly.
and how that's related to pain.
Yes. This study was particularly interested in something called system segregation,
Okay.
which basically measures how distinct different brain networks are from each other.
So like if you have a city with very defined neighborhoods, that's high system segregation.
Exactly.
And if the neighborhoods all blend together, that's low system segregation.
You got it.
Okay, and how does that relate to pain?
Well, there's a theory that people who are more sensitive to threats,
Okay.
meaning they tend to see ambiguous situations as dangerous,
Hmm.
might have lower system segregation in certain brain networks.
Interesting.
This could mean that the parts of their brains involved in processing emotions and processing pain are more intertwined,
Okay.
which could lead to a more intense experience of pain.
So if those areas of the brain are more connected,
Yeah.
a threat signal might trigger a stronger pain response.
That's the idea, however. This study found that the results actually varied depending on which brain parcellation scheme they used,
Okay.
and whether they were looking at data collected while the person was at rest or while they were doing a task.
So it's not as simple as saying low system segregation equals more pain?
Unfortunately not. The brain is incredibly complex.
Yeah.
And we're still unraveling all the mysteries of how it processes pain.
Right.
This study just highlights that complexity
Yeah.
and the need for more research in this area.
It's like we're getting a sneak peek behind the curtain,
Mm-hmm.
but we haven't seen the whole show yet.
That's a great way to put it, and that's what makes this research so exciting.
Yeah.
There's so much more to discover.
I'm excited to keep learning.
Me too. It's really fascinating, though, how all these studies point to this one key idea
Yeah, what's that?
that our experience of pain isn't just, a simple physical sensation.
Okay.
It's heavily influenced by our thoughts, expectations, past experiences, all that.
It's like our brains are trying to make sense of everything,
Right.
including pain signals.
Exactly.
And they're using all sorts of information to do it.
And that's a really crucial insight
Okay. Yeah.
because it suggests that we can change how we experience pain
Okay.
by changing how our brains interpret those signals.
So it's not about getting rid of pain entirely.
Right.
It's more about changing how we relate to it.
Exactly. And that's where mindfulness practices come in.
Okay.
They're not just about relaxing or reducing stress.
Right.
They're about fundamentally shifting how we perceive and respond to our inner experiences, including pain.
This reminds me of that study on pain cueing we talked about earlier.
Yeah.
It seems like mindfulness could be helping us interrupt that automatic chain reaction in our brains
Ugh.
when they predict pain.
That's a great way to put it. Instead of immediately tensing up or spiraling into worry when we encounter a cue we associate with pain,
Mm-hmm.
mindfulness can help us create a pause. It gives us a space to observe the sensation and our reaction to it without judgment.
It's like hitting the pause button on that old pain program
Right.
that's been running in our brains for who knows how long.
And in that pause, we have the opportunity to choose a different response.
Okay.
Instead of getting caught up in fear and anxiety, we can approach the sensation with curiosity and acceptance.
That sounds like we're rewiring the circuitry,
Yeah,
replacing that old program with a new one
right.
that's based on awareness and acceptance instead of fear and avoidance.
Exactly.
I love that.
And that new program, that mindful approach, can have such a positive ripple effect.
In what way?
We might experience pain less intensely, but we might also find ourselves less afraid of pain.
Okay.
We might feel less limited by it and more able to do things that bring us joy, even if there's some discomfort involved.
So it's not about pretending the pain isn't there.
Right.
It's about recognizing that pain is a part of life,
Uh-huh.
but that it doesn't have to control our lives.
Yes, exactly. And that shift in perspective can be so liberating.
How so?
It's like going from feeling like a victim of pain to feeling like an active participant in shaping your own experience.
That makes a lot of sense.
Yeah.
So what does all of this mean for someone who's living with chronic pain?
Right.
Is mindfulness a cure-all?
Mindfulness isn't a magic solution, and it's important to be realistic.
Okay.
Chronic pain is complex,
Yeah.
and there are many factors at play.
Mm-hmm.
Mindfulness is just one tool that can be helpful.
Right.
The research we've been looking at today suggests that mindfulness can be a powerful addition to other pain management approaches,
Okay.
helping people develop a healthier relationship with their pain and improve their overall quality of life.
So how does someone actually start cultivating this mindful approach to pain?
Yeah.
It sounds great in theory,
Right.
but putting it into practice seems like a whole other challenge.
That's a great question. Mindfulness is a skill.
Okay.
And like any skill, it takes practice.
Right.
There are many different mindfulness techniques that can be helpful,
Yeah.
from formal meditation practices to informal things you can do in your everyday life.
So it's not just about sitting on a cushion and meditating for hours.
Not at all. Mindfulness can be as simple as paying attention to your breath for a few moments,
Okay.
noticing the sensations of your feet on the ground as you walk,
Hmm.
or really savoring each bite of food when you eat.
Yeah.
It's about bringing awareness to the present moment no matter what you're doing.
It's like finding those little moments of presence throughout the day,
Exactly.
those chances to step out of autopilot and tune in to what's happening right here, right now.
Exactly. And the more we practice that mindful awareness,
Mm-hmm.
the more it becomes a habit, a way of being in the world that can help us navigate challenges, including pain, with more ease and resilience.
This has been such an eye-opening conversation.
Yeah, it's really interesting stuff.
I feel like we've gone from thinking of mindfulness as a nice thing to do to seeing it as a potential game changer when it comes to managing and living with pain.
And that's what's so exciting about this research.
Yeah.
It's showing us that we might have more power than we realize when it comes to shaping our own experience, even when we're facing pain.
Yeah, it really feels like we're starting to understand pain like in a whole new way.
Yeah,
And the possibilities for like treatment and management are
it's exciting.
super exciting.
It is. And you know what's really encouraging is that mindfulness is something that's available to everyone.
Right.
You don't need special equipment or medication or anything like that.
Yeah.
You just need the willingness to pay attention to your experience in a new way.
It's like we all have this incredible capacity for healing and transformation within us,
Absolutely.
just waiting to be tapped into.
That's a beautiful way to put it. Yeah. What I find so inspiring about this research is that it reminds us of the power we have to shape our experience, you know, even when we're facing pain.
Okay, so let's sum up some of the key takeaways for our listeners today. What have we learned about mindfulness and pain?
Well, we've seen that mindfulness isn't just about relaxation or distraction, you know? It seems to work on a much deeper level, changing how our brains predict and respond to pain, rather than just masking the pain itself.
It's like mindfulness is giving us a new perspective on pain,
Yeah,
one that's less driven by fear and more grounded in the present moment.
exactly.
What stands out to you as like the most important takeaway?
You know, for me, it's the realization that our expectations and past experiences play such a powerful role in how we experience pain.
Right.
Like our brains can actually amplify pain signals based on what we anticipate or what we've been through,
All right.
making the pain feel even worse.
So it's not just about the physical feeling then.
Right.
It's also about the stories we tell ourselves about that feeling.
Shoot.
So if I'm understanding this correctly,
Mm-hmm.
mindfulness can help us become more aware of those stories, those automatic thoughts and reactions we have,
Mm-hmm.
and choose how we want to respond to them.
It's about taking back some of that power and recognizing that we don't have to be controlled by our brain's predictions.
It's empowering.
It is. And of course, more research is always needed to fully understand the intricacies of how this works and how we can apply this knowledge to chronic pain management. But what we're seeing so far is incredibly promising.
It definitely feels like a shift in how we understand and treat pain is on the horizon.
Yeah, I think so too.
As we wrap up, I keep thinking about that idea that our brains are constantly predicting and responding to potential pain.
Yeah.
What are some ways that we can become more aware of those predictions in our own lives?
That's a great question.
And maybe even change them for the better?
I encourage everyone listening to explore this further,
Yeah.
Pay attention to when you tense up in anticipation of pain.
Okay.
Notice what thoughts come up when you feel a twinge of discomfort.
Mm-hmm.
Ask yourself, is this prediction helping me? Or is it keeping me stuck in a cycle of fear and avoidance? And that awareness opens the door to trying new ways of responding with more kindness, curiosity, and acceptance.
It's almost like we're being invited to become scientists of our own experience,
Exactly.
to observe our minds and bodies with a sense of curiosity and compassion.
And in that process, we might just discover a level of freedom and resilience that we never knew we had.
Well, thank you so much for guiding us through this fascinating topic today.
It's been my pleasure.
It's given me a lot to think about, and I'm sure our listeners feel the same way.
Remember, even small steps towards mindfulness can have a big impact on how you experience pain and how you live your life. So be patient with yourself, keep practicing, and keep exploring. You might be surprised by what you discover.
Thanks for joining us on the deep dive.
My pleasure.
Until next time, keep learning and keep growing.